Okay, thanks, everybody. I know that you got up early after a late night to be here. Do we have any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, we have a delegation on the agenda. I'm not sure if I see the delegation. I don't think so. All right, then we'll move ahead with the consent agenda items, and if Julian arrives, we will. All right, we have a motion to, you don't want to remove any of the items? You want to just proceed? You're moving the whole package? Do we have a seconder? Councillor Foxton, all in favor? That's passed. On to the regular agenda items. There is an item for public health and emergency services, and I believe staff have some, Charlene Sedgwick has some opening remarks.
Good morning, Madam Chair and members of the Community Services Committee. The purpose of the report before you is twofold, really. In 2017, public health staff were asked to review and consider updating a 2004 report entitled Rural Health Study in Waterloo Region. And secondly, public health has a mandate under the foundational standard to complete population health level assessments in order to understand the local trends and needs of the communities we serve. To create this report, public health staff identified key demographic and health indicators, and the epidemiology and health analytics team accessed a number of data sources focusing on socio-demographics, overall measures of population health, morbidity and mortality, health behaviors, and reproductive health. The Population Health in the Townships of Waterloo Region report identifies that the townships have similar or better health behaviors and outcomes in comparison to Waterloo Region overall. Many health issues are of similar prevalence in the townships and would be of similar concern for the region as a whole. Now that the report is available on the region website, we anticipate that community partners will use the information to support the specific work of their organizations. Public health staff will also use the report to ensure that programming being provided in the townships aligns with the needs of the respective communities. Going forward, updating of the indicators in this report have been added to the public health surveillance program and will be updated at a minimum every 4 to 5 years as new data becomes available. Thank you.
Thank you. Are there any questions about the report? I have no mouse. Chair Redmond. Thank you.
Thank you. It's just an observation. I've had the opportunity to talk to staff throughout the Waterloo region. I think one of the things that we often lose sight of when we disaggregate, and it's very important that we talk about township health and the outcomes, and thank you for the report, but it's the fact that staff move around a lot, so that you could have staff that are working in the townships for a while and then get placed in a more urban setting, but they have those sensibilities, and I think that synergy is really, really important. I don't know if you want to comment on staff and the fact that there's a great sensitivity to the differing needs in the urban setting versus the township. I've been very impressed with how much knowledge base we actually have throughout the region.
Through you, Madam Chair, I would agree. I think staff pay a lot of attention to what the needs are in the different settings that they work in and adapt as they need to meet those needs. We're very much aware that it's not a cookie cutter approach to services, and that it really needs to, as much as we can, be tailored to meet specific needs, not on an individual level, of course, but at least at that population level. So I think it's something that we spend a lot of time talking about within our staff teams, and certainly is reflected in how we approach work in the communities.
I see no other questions. Thanks very much.
Thank you.
We're on to information and correspondence. There are no items on our request for information tracking list. Any other business? Seeing none, our next meeting is November 5th. Do I have a motion to adjourn? I have lots of motions to adjourn. I saw Councillor Foxton and Councillor Harris. That was the shortest meeting on record. All in favor? Sorry, dragged it out a little longer.